The purpose of this video is to provide education to the patient and/or caregivers on how to administer an IV push medication. You're going to want to wash your hands for at least 20 seconds prior to gathering supplies. The supplies we will need include alcohol wipes, 2 normal saline syringes, a heparin flush if indicated and ordered, and your medication syringe. Please ensure that your medication syringe is warmed to room temperature prior to use, and your disinfectant caps. Once you have ensured all your supplies are ready, you are going to take your syringes out of their packaging. You are going to remove any excess air in the syringe by slightly twisting off the cap, pushing up, and placing the cap back on. Please be sure not to touch the tip of the syringe, as this will result in contamination and you will need to get a new syringe. Once you have dispelled any excess air, opened your syringes, we can get started on giving the medication. You are going to unclamp your line and remove the disinfectant cap from the cap of your line. Anytime that you access the line, it should be cleaned with a new alcohol swab for a minimum of 15 seconds. To ensure accuracy, you can use a watch or a clock. Once you have cleaned your line, you are going to take your normal saline syringe. Again, be careful not to touch the tip of the syringe. If you do, get a new one. And you're going to connect your normal saline syringe in a twisting and pushing motion onto the cap. You will then flush the entire syringe, 1 ml at a time, as demonstrated in this video. You will then clean the cap of your line with a new alcohol swab for 15 seconds. If you drop the alcohol swab, you should get a new one and start over with another 15 seconds. After you clean the cap, if you would touch it, get a new alcohol swab and clean it again for 15 seconds. Once our cap has been cleaned off, we are then going to take our medication syringe, ensure that it is the correct patient, dose, and that it is room to warm temperature if needed. You are going to connect your syringe, again in a pushing and twisting manner. Each medication has a different duration over which it needs to be pushed. Please verify that with your provider, nurse, or pharmacist prior to administering. For the purpose of this video, the medication was pushed with no time duration. Some medications are pushed over 5 minutes, others are 8. See the specific time duration for your medication. Once your medication is administered, you could remove the syringe and discard. You will take a new alcohol swab. and you will clean the cap for 15 seconds. You will then take your normal saline syringe, the second one, remove the cap, being careful not to touch the tip, and attaching it to your line in a pushing and twisting motion. You will then flush all 10 in a pushing motion, 1 ml at a time. If able, try to leave a small amount of normal saline in the syringe to prevent air bubbles in the line. As depicted in this video, there is just a very tiny amount of saline left in the syringe. We will then clean the cap of our line for 15 seconds with a new alcohol swab. It is recommended that you have a garbage can or a bag nearby for you to place your used supplies for discard. You will then take the cap off your heparin syringe, being careful not to touch the tip, and connecting it to your line in a pushing and twisting manner. You will then flush the heparin in, and again leave a very small amount in the syringe to prevent air bubbles in the line. Once you have flushed your heparin, you will take a new alcohol swab and you will clean the cap of your line for 15 seconds. Once this is completed, you will take a new disinfectant cap and place it on the cap of your line to help prevent any infection. Lastly, you will take your slide clamp and you will clamp your line closed.